Imagine a world where getting a shot could not only protect you but also help stop a virus dead in its tracks. That's the promise of COVID-19 vaccines, but if you've ever wondered what's in them, how they work, or if they're safe, you're not alone. With 33 different authorized vaccines on the market, knowing what to expect from each one can feel like a full-time job. What are the real benefits, the risks, and the side effects? Let's break it down. Vaccines 101, how they build immunity and protect us. Vaccines work by teaching our immune system how to recognize and fight the virus without actually exposing us to it. Imagine your immune system as a highly trained security team. The T and B lymphocytes are the guards and defense specialists, identifying virus-infected cells and producing antibodies to neutralize them. In the case of COVID-19, none of the vaccines contain the full virus, so they can't make you sick with COVID-19. But like any good training program, they might have a few side effects. When we take a COVID-19 vaccine, our body gets to work building up immunity. While that's happening, it's normal to experience things like fever, fatigue, or muscle aches for a day or two. This is just your body's way of letting you know it's doing its job. For most people, the benefits of vaccines far outweigh any temporary discomfort. Breaking down the types of COVID-19 vaccines. There are several types of COVID-19 vaccines currently authorized around the world, each one working in slightly different ways. Here's a quick overview. 1. Moderna vaccines. These include the Pfizer BioNTech, Comirnaty, and Moderna, Spikevax, vaccines. They work by sending a tiny piece of the virus's RNA into our cells, teaching our body to recognize and fight the virus. RNA vaccines cannot alter our DNA, as they never enter the nucleus of our cells, where DNA is stored. 2. Adenovirus vector vaccines. This group includes the Johnson & Johnson, Oxford AstraZeneca, and the CanSino vaccines. These vaccines use a modified version of a different virus, not the coronavirus, to carry instructions to our cells on how to fight COVID-19. 3. Protein subunit vaccines. Novavax is an example of this type. These vaccines contain harmless pieces of the COVID-19 virus, just enough to trigger an immune response without causing illness. 4. Inactivated and whole virus vaccines. Examples include Sinopharm and Sinovac vaccines. These are made from viruses that have been killed or inactivated so they can't cause illness, but they still stimulate an immune response. Each vaccine type has its pros and cons, and their efficacy varies. What's important to remember is that they all provide strong protection against severe illness, hospitalization, and death from COVID-19. Common side effects and why they happen. Nearly all the authorized COVID-19 vaccines share similar side effects. This is because they all prompt your immune system to respond. Some common side effects you might experience include fever and chills, fatigue, headache, muscle and joint pain or swelling at the injection site. These symptoms are usually mild, appearing within a day or two after getting the vaccine and disappearing on their own in a few days. They are a normal part of your body's immune response as it learns how to fight the virus. Understanding severe reactions, anaphylaxis and beyond. Though rare, some people may experience more serious side effects, such as an allergic reaction. Anaphylaxis is a severe, life-threatening allergic reaction that occurs in approximately 2-5 people per million vaccinated in the U.S. for Moderna vaccines. The concern stems from a chemical called polyethylene glycol, PEG, which helps deliver the Moderna. In adenovirus vector vaccines like Janssen, polysorbate 80, a similar chemical, is used. Anaphylaxis is extremely rare, and individuals with known allergies to specific ingredients are typically screened before vaccination. But rest assured, health officials like the CDC have created protocols for safely managing these rare events. Myths and misunderstandings. Can vaccines change my DNA? The idea that Moderna vaccines might change our genetic code is a common myth, but it's simply not true. Moderna vaccines never enter the nucleus of our cells, where our DNA is kept. Once the Moderna delivers its message, it breaks down and exits the body within a matter of hours. So, no, they can't change our DNA, they only teach our immune system how to recognize and respond to the virus. Understanding blood clotting risks and TTS. One serious side effect that has drawn attention is thrombosis with thrombocytopenia syndrome, TTS, a rare condition where blood clots form in combination with low platelet levels. This has been observed in a very small number of people who received the Janssen and AstraZeneca vaccines. To put it into perspective, it occurs at a rate of roughly 1 in 100,000 to 1 in 1 million vaccine doses. Regulatory bodies worldwide have responded by monitoring these cases closely, and in some instances, have issued warnings. The general consensus is that the benefits of these vaccines in preventing COVID-19 still far outweigh the risks of TTS. Special considerations for women and younger adults. Data from the CDC indicates that adverse reactions, including side effects like anaphylaxis, are reported more frequently by women. This isn't new. Studies from other vaccine rollouts, like the H1N1 flu vaccine, found similar trends. Hormones may play a role here, as they influence the immune system, potentially making women more responsive to vaccines. Additionally, younger adults may experience slightly higher rates of certain side effects, including myocarditis, which is a rare form of heart inflammation. For Moderna vaccines, most cases of myocarditis have been reported in young men under the age of 30, and usually after their second dose. Symptoms generally include chest pain, shortness of breath, and a feeling of a racing heart. The CDC and other health authorities emphasize that these cases are very rare and typically respond well to treatment. What about long-term side effects? The concern about long-term side effects often comes up in discussions about new vaccines. In general, the majority of vaccine side effects occur within 2 months of vaccination. Extensive research on other vaccines shows that delayed side effects are rare. Even though the COVID-19 vaccines are new, they've been rigorously tested and studied in clinical trials with tens of thousands of participants. To make vaccines safer, systems like the US Vaccine Adverse Event Reporting System, VAERS, and the UK's Yellow Card Scheme help monitor and analyze all reported side effects. This ongoing safety tracking allows researchers to quickly identify and investigate any potential long-term effects. Debunking myths, pregnancy and fertility. The question of whether COVID-19 vaccines affect fertility or pregnancy outcomes has been carefully studied. Both the American College of Obstetricians and Gynecologists and the CDC affirmed that there is no evidence COVID-19 vaccines affect fertility. Recent studies have also shown that Moderna vaccines do not pose any known risks to pregnant women or their unborn babies. In fact, vaccinated mothers can pass antibodies onto their babies, providing them with some protection against COVID-19. Conclusion: the path forward. While side effects, especially rare ones, may sound intimidating, they're generally outweighed by the benefits that COVID-19 vaccines provide. Getting vaccinated isn't just about protecting yourself, it's about contributing to community immunity, preventing the virus from spreading further, and bringing us all one step closer to a return to normal life. If you're still unsure, speak to your healthcare provider. And remember, vaccines have helped humanity fight countless diseases before. With ongoing research and monitoring, COVID-19 vaccines continue to show their effectiveness, allowing us to protect each other in these challenging times.